Pull up with limbs and things.
Clearly, say it again.
Pull up with limbs and things. Happy 4 as anniversary limbs and things.
All right, thank you. Good evening, everybody. Welcome to Pull Up with Limbs and Things. This is our 4th year anniversary, and that was my son. And tonight we have Dr. Jonathan Randle, and we are talking a little bit about sleep and the aging adult. And we have a lot of times that as we age, some of our sleep habits change. And so I met Dr. Randle at the Dance PT Summit this January, hosted by Jenna Cantor. And I just wanted to make sure that I got some of the information that has helped me to be able to be here to help you as well. And so we are talking tonight about sleep and the aging adult. Welcome, Dr. Randle. How are you?
I'm doing well, thank you. Thank you for having me here. I feel lucky because you said fourth anniversary, and it's
Yeah.
May the 4th.
Right. May the 4th be with
May
you.
the 4th be with you. Yes.
So tell us a little bit about you, how you kind of got started in being a sleep expert, because you're also a physical therapist. So what made that transition for you?
Yes. So, hi guys. My name is Jonathan Randle. Like you said, I'm a doctor of physical therapy. I've been practicing for 7.5 years now, and throughout my journey, I've gone through many things. What started me on this sleep journey was after the pandemic 2020. I was in this bad season of my life, dealing with depression, suicidal thoughts, different things like that. I gained weight. My sleep patterns decreased, went down the tank, and I was able to get through that period of my life, but I still had difficulty sleeping. And I had a philosophy of rest, and rest for other people, rest for myself, and what does rest look like in this world of unrest during the pandemic or right after the pandemic, right, of unknown. Um, so that's where the sleep journey began. I wanted to see how you can control your body's ultimate rest state, which is sleep, right? So I got a sleep coach myself. I started tracking my sleep. I started tracking data for years of my own sleep habits and patterns. I'm a traveler as well. So, what does that look like as someone who travels from place to place
Yeah.
and stays in different locations? What does that look like? So, learning how my body functions, how it works, especially with sleep, and learning how to improve upon that over time because it takes time, has influenced and impacted my life tremendously. So I'm excited to share some of that knowledge with you guys as well.
Awesome. So if you're watching and you want to make a comment, you can put the comment in the chat. If you're watching live, we always appreciate if you put hashtag live. If this is caught on the replay, you can hashtag replay. But pull up with limbs and things is to confirm something you know, to challenge something you don't know, and to give you an opportunity to share that information with someone else. So, Dr. Randle, do you have any specific points that you want to share with us that are specific to us having restful sleep like you described?
Yeah, well, yes, I have many points.
Okay.
So I'll try to be as specific as I can. But first,
All
I
right.
want to just generalize what is sleep. Sleep is this state of the body where it's not a passive state; it's an active state where you are, laying your head down and your body is starting to repair itself in many ways, from the course of the day and from the events of the day. So
Mm-hmm.
just kind of going into this, what is sleep. You're when you lay your head down at night, you start to drift off. Your heart rate decreases, your blood pressure decreases. Everything normally, this is what normal sleep is supposed to look like, right? Everything is supposed to decrease, and then I kind of think of it as you're drifting into the ocean, right? And then you're diving deeper and deeper and deeper. The deeper you go into sleep, that's when you get into this physical restoration of the body.
Mhm.
You go back up a little bit and you get memory consolidation. So it helps with memory, it helps with memory connection, it helps with emotional capacity. Someone who doesn't get a lot of sleep during the night, they may be cranky the next morning, right? We've
Right.
all experienced that. So
Mhm.
sleep helps you to control your emotions and regulate your emotions. You get more mental clarity. Like I said, your body is feels refreshed, feels restored, and um, it's how we grow when we're kids going through adulthood, right?
Mhm.
How we rest, how we achieve rest, and how we continue to function throughout the day. Sleep is one of the main core foundations of the human experience of life itself. So that's just a brief overview of what sleep is. Sleep is a lot of times just a blip in the back of a person's mind. It's like, oh yeah, and I got to get
Right,
sleep.
right. Mhm. It is.
Or yes, and I'm sure for older adults it becomes of a problem, especially if it hadn't been addressed prior and
Mhm.
earlier in life, right? Oh, now I'm sleeping X amount of time, and now I can't sleep because X Y Z. Um, so sleep is a normal part of the human experience. It's supposed to be a enjoyed part of a human experience, but many people do struggle with this. Um, so I just wanted to give that kind of brief overview because some people don't even know what sleep is or what the purpose of sleep is or how sleep occurs.
Right.
Um,
I'm glad you mentioned how kids grow up because a lot of times we totally understand the importance of sleep as a baby because we know that they need that in order to develop properly. But that doesn't stop. As we
mm,
get older, we still need those same rebuilding and remodeling things that happen during our sleep. So I'm glad you mentioned
yes. Yes, just as much. And so the question is, what's normal for adults and older adults as we go? And
that.
you
Mhm.
mentioned kids. Kids need much more sleep than adults. And when you become an adult, rather, 7 to 9 hours is the standard. We hear that all the time. Let's get 8 hours of sleep, 7 to 9 hours of sleep.
Mhm.
That continues throughout our adulthood. That is the standard of amount of time that we are supposed to have asleep. And so, if you're not getting that time, then something needs to be adjusted. If you're not getting that time, then something needs to change.
Mhm.
And older adults are an interesting category because you're going through this transition period of your life, right? You're transitioning in a lot of ways, and I have a couple ways where for you guys, your sleep patterns, your sleep changes, and these I get from multiple resources and from multiple areas. So I
Mhm.
want to kind of summarize the changes that occur for older adults as we age as you age through this life.
Quick
Um,
question for you before you do that. This 7 to 9 hours of sleep, do we need it all at one time or can it be broken up?
so let me go back and say this: if we were to place ourselves back into um, just full out nature, like you see some of these shows where I'm just going to go out to nature and be naked and all that stuff, right? Well, if
Yeah.
we were to do that, everyone collectively, we would realize that the body knows how to sleep naturally.
Okay.
We as a society have placed so many things around us and changed so many things around us that it confuses our natural patterns of sleep. So
Hmm.
so yes, in general, that 7 to 9 hours is usually at one time. You go to sleep, you follow your body's what's called circadian rhythm,
Hmm.
and you ebb and flow with the sun. So when the sun rises, your cortisol rises as well, which is the stress hormone. You wake, and then as you go through the day, melatonin builds up in your body. Sleep pressure is what we call it. Sleep pressure builds up in your body
Okay.
to gear yourself up to sleep. and we sleep when the sun goes down because light controls is the control factor of sleep. We start to get drowsy and then we drift off to sleep. So yes, in general, 7 to 9 at one time. If you are not getting, now I say that with the caveat, if you are not getting enough sleep, there are times where if you are getting it throughout the day, then that is also sufficient, but it's not always the best. Everyone's different. Everyone's different. It's how your body responds, how you are best responding. No person is the same. So
Yeah,
sometimes it's best for someone to get multiple, little spurts of sleep. But I would say in general, it's good to just get it at one time.
gotcha. Okay. Yeah,
Yes,
no point.
yes. And if you have any more questions, just let me know. But
Okay.
so here's how sleep changes. Okay.
Okay.
Um, so we have what's called in our cycle of sleep. So because our sleep goes in cycles, our brain waves um, goes in cycles. For the older adult, the brain changes, and the parts of the brain, especially in the middle part of the brain, that changes is the part and unfortunately deteriorates over time. Is the part that affects what's called deep sleep. And what
Hmm.
is deep sleep? Deep sleep is that is when we are physically restored. So to go back again, the first couple of hours of sleep when we when we finally hit the bed, our head
Right.
hits the bed. That first couple of hours of sleep, we do more deep sleep. We have more deep sleep, and then as the hours of the night go by, we don't need as much deep sleep because the body has finished physically restoring. We're doing more mental restoration. We're doing more emotional restoration. The parts of the aging adult that in the brain that help control that deep sleep decreases as we age. On
Mhm.
so this could be so the reason this could be one of the reasons we'll grow older, and as you're aging, you're saying, I feel more fatigued. My body is just feels blah, right? I don't feel as energized like I used to. It
Yeah.
could be that your deep sleep is being is has been affected. You're not getting as much physical restoration for your body as you used to when you were younger. So that's one thing that changes as you age. Another thing, that's number one. So number two,
Hmm.
your sleep is fragmented, right? So what that means is you're waking up throughout the night.
Right.
Um, the main thing that can cause this or causes this with older adults is having to go to the bathroom.
Hmm.
You have a weakened pelvic floor, or you're taking a lot of diuretics,
Hmm.
or you're drinking a lot of water.
Yep.
So I hear all the time as a therapist, yeah, I have to go to the bathroom 6 to 7 times a night. 6 to 7 times.
That's a
That
good
is
one.
a lot.
Yeah.
Let me tell you what is normal for even as you age. This is what's supposed to be normal. And I just had a conversation and a video for my course for with a pelvic floor therapist because
Mhm.
this is a huge thing.
Right.
And they informed me, and many have informed me that once during the night is considered normal after the age of 60. So for women and men, because women go through postmenopause,
Right.
one time a night is normal. So
Mm.
if you are going 3 times a night, 4 times a night, your sleep is fragmented. You're not getting the full amount of hours that you need. It's also an injury risk because like I said, your physical restoration is not there, so you're feeling really drowsy.
Hmm.
The lights might not be on. That's when we see a lot of falls happen.
Right. Right.
Trying to
Hmm.
get to the bathroom because either my pelvic floor is weakened, I have diuretics. I need to go to the bathroom constantly. My sleep, and now I'm tired, and now I'm injured, and now you're seeing us.
Hmm.
So that's another cause of um, or another thing that can change as you grow older is your sleep just gets fragmented. It's no longer the smooth, uninterrupted sleep cycle. It's I get up and then I go back to sleep and then I try to go back to sleep and then I sleep for a little bit and I get up again and then da 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 da.
Right.
So that's number two. Number three, circadian rhythm changes. What that means is when everyone has a circadian rhythm, humans go by a circadian rhythm. As I mentioned before, we rise with the sun, we go to bed, with the sunset.
Hmm.
And that's our normal pattern as humans. What changes and what we usually see with older adults is I'm going to go sleep earlier. And we go to sleep earlier and then we wake up earlier.
Yeah.
And then we go to sleep even earlier, then we wake up earlier. And we're no longer going, sometimes we're going asleep too early.
Hmm.
And that upsets or changes our natural circadian rhythm. And that's why you're not being able to go get to sleep again because you're already up.
That's
or
true. A
you
lot of
or
people
you've
eat
already
dinner earlier, and then that means they go to sleep. Like I have some people that eat dinner at 5 o'clock, and they sleep about 7:30.
mhm,
Back up at 12 o'clock.
at 12 o'clock, right?
Mhm.
Because their rhythm changes, the
Yeah.
rhythm of their sleep changes. And so that's one way, that's another change that happens. The fourth thing, I said I have five things. Fourth
Okay.
thing, lifestyle changes.
Oh yeah.
Lifestyle changes. What does this mean? This means as I get older, I'm no longer as active,
Hmm.
right? I'm no longer I'm inside more.
Yep.
Um, I no longer I'm retired, so I don't have as much purpose. So I'm just not moving around as much. I don't go out to the events as much.
Hmm.
Um, I'm eating less of this and more of this, or maybe I'll just have a little cup of coffee at the in the evening time because I got nothing else to do.
Yeah.
Or your family moves,
Yeah.
or you're stuck in the house. I see this in a lot of home health patients. You're stuck in the house watching TV. I went to a patient's house. They couldn't move. Why couldn't they? But when I went there, and there was other things involved, but
Hmm.
what were they doing? They were sitting down, watching the news,
Yeah.
which 80% of the news is bad news, 20% is good, right? So they're stressed, their
Yeah.
anxiety is high, and they wonder why they're not able to sleep at night.
Mm.
Well, they're inside, there's no sunlight anywhere, they're watching bad news all the time, being stressed out, they're not getting any physical activity, they're not eating correctly. All of this affects your sleeping pattern. So this is lifestyle changes as you get older.
Absolutely.
Hopefully this is helping some.
It is. It is. I'm gonna break it up for a little bit. You do have a question. Does it matter when you go to bed? I consistently go to sleep at 12 a.m. and then get up around 7 a.m.
It does matter when you go to bed, and it matters with your body's natural pattern. So, like I said before, everyone is different. Everyone is unique. Some people go to bed earlier. Some people go to bed later. Some people are morning birds. In fact, around 30% of the population are morning birds. 70% are night owls.
Yeah.
So it may be best for your body, and you may have always known this throughout your life, that I feel better when I go to bed later, and that just may be your body's natural pattern.
Hmm.
Um, if you are consistent, that is the best thing. Consistency is the key word. As long as you are consistent with a certain pattern, then you are already ahead. Your body loves consistency. So if you're feeling good, you're still feeling energized, then there shouldn't be too much of a problem.
Gotcha. Okay. Follow up question. How long can a person stay awake before shutting down? Is that dependent on the person too?
How long can a person stay awake? What do you mean when you say stay awake? Does that mean stay awake during the day, or um, does that mean waking up at night and then staying awake? I'm not sure.
Let's say it's staying awake, no sleep. So the person does not sleep at all before they just have to get rest.
Um, there was a um, a competition in Guinness World Record that
Mhm.
someone tried to break the record of no sleep,
Mhm.
and Guinness rarely does this, but Guinness deemed it too dangerous because sleep, if you don't sleep for a certain amount of time, I think is comparable to water. If you don't sleep for a certain amount of time, you'll die. Um, so your body will shut itself down.
Okay.
It's a fundamental thing. So how long? I would say, if you're talking about that specific, right? You
Mhm.
no more than, 48 hours, 72 hours,
Mhm.
not before you die, but before you start to get detrimental health
Facts, yeah.
deficits. Hmm.
I can see that. I can see that a lot, especially in the people that we see. There are some that I can tell you did not sleep well the night before, and now all the things that we had done previously, we're slipping backwards.
And
To
I'll
ask,
tell you this.
you sleep?
Exactly, and I'll tell you this, the study has been shown that if you only get 4 hours of sleep, you're the same as a drunk driver.
Right, right.
So
I
a lot
remember
of people are a lot of people are getting only 4 hours of sleep, and they're getting on the road, and that's where we see a lot of accidents, but
you.
big
Hmm.
truckers, only 4 hours of sleep, and then what happens? Their brain is saying, "I need rest, I need to sleep." Shut it down. And it shuts down, but they're doing something that causes danger to other people. So that's why it's so important to make sure that you are getting adequate rest, and sleep, because it could be a detriment to you or someone else, especially if you're still driving or still on the road or making decisions that are, affect a multitude of people and yourself.
Right.
It really affects that.
Oh, that was good. I didn't know that about Guinness. Okay.
Mhm.
What is the purpose of dreams for development?
Dreams. So dreams are still, they have been studied for millennia, and yet we still don't know a lot about the true purpose and actuality. So what dreams are part of, what we when we usually dream is in the cycle. Remember, because the sleep goes in these waves and
Right.
in cycles, right? So you have deep sleep, which is your deepest sleep. You're not really dreaming at all,
Hmm.
but you could, but it's less likely. There's
Okay.
a stage called REM sleep, and that's when the brain is actually more active than when it's awake in many cases. That's when you dream. That's usually the spot when we associate with dreaming. That state is good for creativity,
Hmm.
connections, um, learning. So you may have asked yourself a question that you didn't have an answer to, but then when you fall asleep and when you're able to dream, suddenly you know the answer, because your brain is making associations and connections that it would never had made in the conscious realm, and unless it was in that high activity brain state. It's a high activity brain state during dreaming. It's like you're awake. That's why people sleepwalk, or you're in this kind of sleepwalking phase. It feels like you are awake.
Yeah.
Um, and so it's tremendous for creativity. It's
Hmm.
tremendous for emotional capacity, um, and just overall making connections in your brain, because your brain is plastic. Is not static.
Very good points. I was going to ask you about sleepwalking and talking in your sleep, and at what point does that occur? But thank you for answering that.
Mhm.
Okay, another question for you. How can you get a better night's sleep?
Good question. I'm going to go over that after I do the fifth point.
Okay, go ahead. Let's get the fifth point.
Yes. Okay. So let me get the fifth point. So fifth
Okay.
fifth point is something that people don't often think about, but it's actually very important. We see it all the time as physical therapists and providers, but that's social activity. What changes for older adults is the social interactions, and
Yeah.
I think that changes more for older adults in America or in westernized countries.
Hmm.
We have prioritized independence so much that before, it was the case where people took care of each other and were more together. And we all know that social interaction, touch, physical interactions, friendships, that is important for your emotional health, for your nervous system. You're
Yeah.
much more calm, you're much more relaxed. You release oxytocin, you release serotonin,
Mhm.
everything that's important for comfort and security and rest. And as you get older, a lot of times, unfortunately, we lose a lot of social connections, friendships leave, our family leaves.
Yeah.
We're placed in um, we're placed in environments that are unfamiliar or don't have a lot of social interaction. So, but some so that's a sad situation. I think in America definitely needs to change because in other countries it's still prioritized as you grow older to take care of each other.
Yeah.
Um, so a lot of cultures still have that, but a lot of cultures don't. So I think that's important for sleep as well, because when you feel relaxed, when you feel secure, when you feel seen and heard, your body is in this rest state. It's in
Yeah.
a more relaxed state, and you're not in this worry, stress, sympathetic state. So I
Mhm.
think that's also important. That's not something that you see in a lot of books or anything like that, but it's something that I've observed personally, treating patients who are older. Let's get more social interactions, and that's part of the interventions that I put down as well.
Awesome. Well, those are really good 5 points. I like those. Okay, let's see. We do have a few more questions. Want to come back to the one about how can you get a better night's sleep?
Okay. Um, so many ways. It depends. So what I like to do first with clients that I work with, I like to gather data because it
Hmm.
tells you, where do you need help sleep in the first place. Are you drinking too much caffeine? Are you going in the bathroom too many times a night?
Right.
Are you going to bed too late? Are you going to bed too early? So it really does depend. That's kind of a generalized question, but let
Yeah.
me go through these interventions that I think someone you can implement. And if you have this good routine, it's called sleep hygiene. If you have like just any hygiene, if you have good hygiene, your body feels better, you feel better, you do better,
Right.
right? So this sleep hygiene, what is sleep hygiene? What is good for the body to get more sleep? One, and the most important, I think, sunlight. Are you getting enough sunlight throughout the day? Sunlight, light is the signal to wake and the signal to sleep, or in lack of light is the signal to sleep. So light
Mhm.
controls your sleep pattern. If you are getting enough sunlight throughout the day, that's good. You're getting that vitamin D. Your vitamin D levels are important for sleep as well.
I
Your
can hear
your
somebody say, "So what happens when it's cloudy outside?"
there's still light that comes through the
Yeah,
clouds, so
exactly.
you're still getting sunlight.
Hmm.
A lot of people use artificial lights in their home, and if you don't have anything else, you use that
Hmm.
and you want to get enough sunlight, because a lot of times you're in the house, shutters, you're watching TV, you're not getting outside. You need nature. Ooh, I love. I was in Guatemala for a couple months ago. I got
Yeah,
sunlight so much, and guess what? My sleep was so good,
I bet.
because I was getting nature in me all the time. We were meant to be in nature as well, right? So that's
Yeah.
one. Um, Water. Are you drinking enough water? Some people aren't drinking enough water and their blood pressure drops, and there's a whole other situation. But here's the caveat with that: drink water more in the beginning of the day, lessen it during as you transition through the evening. Because
Okay.
what happens? You drink too much water, too much liquid.
You're going
Your
to the bathroom.
pelvic floor is not strengthened, because who strengthens their pelvic floor, especially as you get older, right?
Mhm.
That needs to be that's another topic, but you start going to the bathroom more.
Mhm.
So drink water, make sure you get enough fluid in you, but prioritize it more in the morning time than the afternoon time and then the evening time.
Okay.
Change your diet. Yeah,
Two.
change your diet. Change your diet to healthy foods.
Okay.
Right. So last night, what happened? I went to a ball game. I ate some hot dogs. Like I ate two hot dogs. I ate two hamburgers, and I drank some tea that had some caffeine in it. Did
Uh,
I have good sleep last night?
Probably
No,
not.
I did not.
Mhm.
I was up. Your stomach and your brain are connected. If you're constantly eating foods that inflame you, and we tell this to patients all the time, right there,
Right.
right, Dr. Chanel. If
Mhm.
you are eating foods that are inflaming you, your joints are inflamed, your pain level increases, you're in this sympathetic state because your body can't rest because it's trying to fight off this inflammation that's happening all the time. So you want foods that do not bring you inflammation, do not give you acid reflux.
Mm.
You want to make sure that you're not eating too late in the day because our digestion actually it takes around 4 or 5 hours to digest food. So say you just went to the kitchen at 8 o'clock and you ate a little snack that it was a little bit more than a snack. What happens? Your body is still digesting that
Right.
at 2 o'clock in the morning, and
Mm.
you're like, "Oh, why am I up at 2 o'clock in the morning?" Well, my body just my stomach just tried to turn over something that it wasn't supposed to be turning over
Yeah.
that late, right?
Mm.
So give yourself time to digest food. So diet, that's a whole course in itself. Make sure your diet, get a nutritionist if you need to. That's
Yep.
so important. Exercise. I was going to put some exercise in here as a physical therapist.
Absolutely.
Your body is fatigued because your deep sleep is decreased, but
Mhm.
you probably are not fatiguing your body enough throughout the day in order to build up sleep pressure. There's a difference in those two. You want to build up sleep pressure throughout the day by being active, exercising, fatiguing your body so that your body feels like, "Oh, I need to rest." If your body doesn't feel like it needs to rest, it won't rest. You'll
Sure.
just be antsy all the time, or you'll have this energy all the time,
Mhm.
right? So it is important for you to get up, move, do activities, go dance, go. The American Heart Association suggests 10,000 steps a day. I
Mm.
still recommend that to my older patients. Get your steps in.
Mhm.
You track it, right?
Right.
So that's another exercise is so important for your mental health, physical health, your sleep health as well. And with that, pelvic floor training. Make sure you're strengthening your pelvic floor. Why? Because your pelvic floor controls um, a lot of functions, but urinary functions as well. There's different things that affect pelvic floor, but if
Mhm.
you can strengthen that so that you're not having to get up and go to the bathroom all the time, that would be tremendous for your sleep. You're not getting up all the time, and you're reducing your risk of falls as well.
Absolutely.
Um, Decrease naps throughout the day. So I know that a lot of people love naps,
Yeah.
but as you age, it just seems that everyone's napping a little bit more than they probably should. Sleep pressure. Naps naturally reduce sleep pressure. So imagine that sleep pressure is this kind of valve, and you're building, building, building. Whenever you take a nap, that sleep pressure, you're
Lisa.
unloosening the valve a little
Yeah.
bit.
Mhm.
You need that sleep pressure in order to get to sleep and to stay asleep. So if you're taking naps throughout the day, your body's just like, why do I need to sleep? I slept through the day, right? So decrease the frequency of how often you are taking naps throughout
Okay.
the day, especially if you have a trouble with sleep.
Mhm. Okay. Now some of our older adults they'll take a nap like this and get up in the next 20 minutes, and they
Uh-huh.
think, okay, that doesn't count toward building up the sleep pressure because that was just a short nap right here, like watching a show, and they get drowsy.
Mm-hmm.
But then there's a longer nap that could possibly occur, say when they're reading the paper or something like that,
Mm-hmm.
and then the naps get longer. So I just want to know, naps that are specific times, does that matter? Like the shorter naps versus the longer duration naps.
Again, it depends on the individual. Sometimes shorter naps they reduce the sleep pressure just as much as the longer naps. They
Mm.
may reduce it less, but there's if you take multiple throughout the day, it's the
Mhm.
same amount, right?
Gotcha.
So if you feel like your sleep is is being affected or bad right now, and you know you're taking a lot of naps throughout the day, you need to reduce the amount of naps that you take and let your body fatigue even more and more, so that when you do finally rest at night, same thing with it's actually similar to babies, which is interesting. You're kind of doing going back to what may have happened as a baby. You know, babies who sleep too much throughout the day take too many naps, too many long naps too. They won't sleep at night, so it's the same.
Yeah.
It's the same.
Okay.
Um, ooh, turn off the news. People don't like that. What is the news? 80% what? Bad news, 20% good news,
Mhm.
right? Don't increase your anxiety and stress over things that cannot be changed, that you cannot change. There was a Netflix show um, called The Blue Zones, and there
Mhm.
was one. It is a new documentary. I recommend everyone watch it.
Okay.
But there was a comment from these centurions, people who are living 100 years old,
Yeah.
and I think one person in Italy, who was like 80 or 90 years old, they asked, "What's the secret?" And they said that uh, we're farmers. This is only we only worry about the things that we can control. We're not.
Mhm.
We can't watch. We don't even have TV. We can't watch the news. I don't know what's going on in the world. I know what's going on around me. I have control around that. And because of that, they're not in this constant state of stress. The news is stressful.
We
I don't
definitely
care what anyone says. The
can.
news is stressful.
Yeah.
When I turned that out of my life, especially after 2020, and oof, that was a thing.
Yeah.
Um, my mental health improved. When your mental health improves, your physical health improves as well.
That's true.
So turn off the news. If you're watching this news all day, death, destruction, killing, all of that all the time, political, whatever, division, that's not feeding your soul. That's not
It's not.
inputting good things.
It's so interesting too, because I say this to my patients, and I get these looks because they'll say, "Well, did you hear about this?" I said, "No, you are my news. I don't watch the news."
Hmm.
And so it's very interesting because yes, they have the minutes on everything that's going
Yes. Use that time to get up and exercise.
Right.
For real. Um, Socialize, touch. Like I said, I mentioned before,
Hmm.
touch is so important. Socialization is so important. Optimize your environment. So make sure that your room is dark, your area is cool, you're not having any electronics in the bedroom, right?
Hard.
Things that is hard in this day and age.
Right.
Yes, things that have blue light. You may want to get blue light blocking glasses for
Yeah.
the nighttime, or just eliminate it in total. A lot of people sleep with the TV on. I would, if you're having trouble sleeping, um, start working on turning the TV off through the night. That is a habit. That's a pattern. So your body is used to. Okay, when this is on, that's when my body knows, okay, to sleep. But that
Right.
may actually um, be a detriment to you in the long run. So if you do have your TV on, make sure that it has a timer to go off in like 30 minutes or something, like 15 minutes. Okay, is what I suggest. But decreasing all light in the room, making sure your room is cool, make sure your bed is comfortable. Some of y'all have been sleeping in the bed for the last 40 years, older than I am. um, Change your bed if you
Yeah.
can.
Hmm.
Um, that will help tremendous. Let clean, make sure everything is cleaned, because the dust and allergies can affect your sleep.
Yep.
Um, with things with older adults is some have trouble breathing at night, so they have a CPAP or they have to be elevated. So
Hmm.
just elevate yourself. Um, if you have a CPAP, do the best you can with that. You'll have to learn how to adjust to that. Your body will have to learn to adjust to that. If you're sleeping with someone who has a CPAP, well, my suggest and you're having trouble sleeping, you may another room may be available. I'm
Hmm.
just saying that's not totally a bad thing for your peace of mind and and everyone else's. It's okay to go into a different bed that's more optimized for you in order for you to get rest so you can help with everyone else and what you need to do. I'm just going to leave it like that. You have my permission. You have permission. Um, and then decrease caffeine. Like I said, some people drink caffeine way too late in the day. And what I mean by
Caffeine is chocolate too, right?
caffeine is chocolate, caffeine is coffee, caffeine is soda, energy drinks, caffeine is
Mhm.
tea,
Yep.
caffeine is in many substances that you don't even realize.
Right.
Um, and you're taking that late in the night, and that caffeine is just keeping you up at night. Sometimes that's the solution. Just decrease your caffeine intake. Only do it in the morning. Nothing after 12. Nothing after 2, because
Hmm.
some people genetically cannot degrade the molecules of caffeine, and so it stays in their system. The half life of caffeine, I
Yeah.
believe, is um, 6 hours. The quarter life is 12
Oh, wow.
hours.
Yeah.
Right. So the caffeine is a stimulant. It stays in your system for long periods of time. So
Right.
if
Right.
you're having trouble sleeping, look at how much caffeine you're consuming, decrease it. Okay. So over time, slowly. And then medication. I know we touched on this, but a lot of older adults take medication. Medications are stimulants as well.
Hmm.
So a lot of people don't realize that they can affect. If you take medication, they can affect your sleep by keeping you up because they're stimulating your central nervous system. There also can be diuretics, so they're keeping you up because you have to go to the bathroom to um, force out the liquid,
Yeah.
right? Uh, so medications, just keep in mind, you may want to ask your doctor, hey, how do my medications interact with each other? Will this keep me up at night? Is this a stimulant medication? If so, you may need to change it to more of a morning time than an afternoon time. Again, talk to your doctor, to your pharmacist for
Hmm.
the best advice. But you can let them know, let your doctor know, let your pharmacist know, hey, I'm having trouble sleeping. Will this
Yeah.
medication keep me up? And they
That's true. I
may
think a lot of people think these side effects are just things that they have to live with, but you don't. You just need to ask the right.
just ask the right questions and have that conversation with your doctor. Say, hey, I'm taking these medications. I'm not sleeping. Is there a way we can change this? Or is there something else that I can have that would be
Mhm.
just as effective? And you never know, that may be.
Right.
Um, that's all. That's the majority. If you just do all of that,
You'll
I
be
know
good.
that's a lot, but even just a slow change, just one change, and you do that 1%. That's what my coach told me. Just 1% at a time, over time, can build up to something that's massive. That can make a huge difference in your life.
Absolutely. I'll give my little testimony from hearing your presentation before. Changing the light or input of light. I wear this little eye mask to sleep. It really helps me to block out light better than it has been. And I've been getting better sleep just from doing that. So, yes, it can be one thing that you can change that'll help improve your sleep.
I
Okay.
learned that vitamin D. I wasn't getting any REM sleep, or I was getting so little REM uh, REM sleep. I
Hmm.
was recording it through my app, and I stopped taking vitamin D because I thought I needed vitamin D after the pandemic. I wasn't going out as much. I needed more energy. I never took a blood test, so I didn't know if my vitamin D levels were low or not. Sometimes you need to take a blood test to see what levels are low.
Right.
But when I stopped taking that, all of a sudden my REM sleep, which is my dreaming state, connection, emotional connection, mental connection, that increased, that skyrocketed. And I said, well, maybe it was the medication that I was taking. So when I made that small change, that changed drastically my body, my physical habits.
That's good to know too. Okay. We have a couple more questions. Let me see if I can get through them. Good evening. I am a sexy senior citizen of 65 years old.
All right,
I,
all right.
I have always been a nocturnal personality full of energy. I'm finding that after I eat, 20 minutes later, I need to take a short nap. What the heck? What is going on? Is my body needing me to take a nap because it needs energy to digest the meal?
Good question. The questions you need to ask is, when am I eating? So record the time that you're eating. And this is happening after you nap. Is it every time? Is it only certain? Is it afternoon? And then what are you eating? Some because carbs naturally produce serotonin, produce relaxation, cause
Mhm.
you to sleep.
Right.
This whole cycle of tryptophan. A lot of foods have tryptophan and then serotonin in them. So, and then your body does need time to digest it. So it's taking energy in order to digest it, and that can cause some drowsiness. We always after that Thanksgiving meal
And look
at
at this.
grandma's house,
She said,
where's the first place you go? To the corner side of the couch. You got to get the corner. You got to claim that corner spot.
so you get the arm rest. Yeah.
Right, because you go into what is called a food coma, right?
Hmm.
So your body's literally full of carbs, and it has to just knock out in order to put all the energy in digesting it.
Hmm. And that's
So
what she
just
said next, or is she having the Thanksgiving turkey syndrome where we all feel tired after eating that turkey?
Yeah, so it could be some of what the food, um, whatever the food is made of, is causing that drowsiness and causing you wanting to take a nap. It could be that it's being too much. It's too much food. It could be the time of day. So those are variables. Those are what I call sleep dials that you can test. You can turn it up, turn it down, and see how your body responds. Okay, if I don't eat as much of this, how does my body respond? If I eat a different substance of this, how does my body respond? If I eat it at a different time of the day, how does my body respond? And just test it out and see.
Good advice. Good advice. Okay, one last question. Is napping not recommended for children too?
Napping is recommended for children at a certain age because
Mhm.
children need around 12 to 17 hours of sleep. So because they're growing, their body needs to rest. Remember that deep sleep, that physical
Right.
restoration, growth hormone, in order to grow. So they need more sleep than us as adults. So yes, it's recommended that kids do take naps if they're not getting a sufficient sleep, especially if they're not getting sufficient sleep throughout the night. It's okay. Their body, like I said, the body knows what it needs to do. We are just putting ourselves in the way of it. And kids naturally get drowsy, knock out, take naps.
Mhm.
That's fine. If it becomes a problem when they're not and when they're taking too many during the day and they're not getting enough sleep at night because they're just up and up.
Right. Well, I thank you so much for joining us. If you want more information about sleep, Dr. Randall's email address is below. If there are other ways that you want us to connect with you, can you share those?
Yes, right now I'm just on LinkedIn or Facebook, so you can look up my name and you can send me a message in that way. But my email at this point in time is probably the best way to connect with me, and just write in there, sleep questions or sleep, and then I will get back to you.
Yep, and he's very responsive. All right. I thank you so much for joining us. Again, pull up with limbs and things is to confirm something you know, to challenge something you don't know, and to give you the opportunity to share this information with someone else. We talked about sleep tonight, and we went through a whole lot of things about sleep hygiene, how we need to maintain the sleep pressure throughout the day so that we can have adequate 7 to 9 hours of sleep a night, and all the things that we can do to have better sleep. So I hope you gained something from this conversation. Thank you so much, Dr. Randall. Pleasure
Thank
to
you.
have you.
Thank you so
All
much
right.
for having me.
Sure. Do you want to leave us with a final thought?
Final thought: no one is perfect. I had to learn that no one is perfect. This takes time.
Mhm.
So if you need to have a friend, or accountability partner, or even just if you're thinking I would never be able, it's okay. Step by step, forward is forward. Any little step matters.
Absolutely. Well, thank you so much. And thank you, everybody. Have a good evening.